Hi class, my name is Brian and I did my research on Planus foot deformity, also known as flat foot. I will first go through the anatomy of the structures involved in the flat foot deformity. Then I will go into the clinical problem of flat foot, outlining symptoms and causes. Next I'll go into the diagnosis of flat foot, followed by various treatment methods, and present which method is the best and why. What exactly is flat foot? Flat foot deformity of the foot is caused by collapsed medial longitudinal arch. This arch is important in providing our feet with rigid stability so that our feet can move mechanically correct. The multiple causes to flat foot include ligament instability, muscle deficiencies, muscle degeneration/trauma, and genetic factors. It is a common deformity that affects about 15% of the world's population, and in several studies I've read, flat foot can be attributed to foot, knee, and lower back pain. I will also talk about how that comes about in a little bit. The foot can be divided into three regions: the hindfoot, the midfoot, and the forefoot. The talus and calcaneus make up the hindfoot, the navicular, cuboid, and cuneiforms make up the midfoot, and the metatarsals and phalanges make up the forefoot. The joints are important in pronation are talocrural joint and the subtalar joint. The talocrural joint allows the foot about 20 degrees of dorsiflexion and 50 degrees of plantar flexion. The subtalar joint allows for inversion and eversion of the foot. It is a synovial joint between the calcaneus and the talus. Now I will talk about the primary muscles of action involved in pronation and maintain the medial longitudinal arch. These muscles are the tibialis anterior posterior, flexor hallucis longus, and flexor digitorum longus. They contract eccentrically when weight is loaded onto the foot to keep the arch rigid so that during the push-off phase of the gait cycle, the foot has a lever to push off of. The medial longitudinal arch is made up of the talus, calcaneus, navicular, and cuneiforms. It is also supported by the stability of the subtalar joint. Both the interosseous ligament and the spring ligament provide the subtalar joint with stability during foot inversion and eversion so that overpronation doesn't occur. The most superficial layer of support for the arch is the plantar aponeurosis, also known as the plantar fascia. There are various causes to flat foot. The most common cause is weakness in the arch. Excessive repetitive weight load during pronation can cause the arch to fall, which can then cause weakness in the support structures of the arch, which make the deformity even worse. Deformity can also be due to genetics causing a formation in an irregular arch. Dysfunction or muscle weakness in the posterior tibialis tendon can cause flat foot. It is one of the main muscles involved in pronation and maintaining the medial longitudinal arch. Its weakness can be due to trauma or degeneration because of aging. Flat foot can also be caused by problems away from the foot-ankle region. Studies have shown that muscle weakness at the hip causes inward rotation of the leg, thus resulting in overpronation, making the arch collapse. The lower extremity can be looked at as a kinetic chain. If one link in the chain is weak, the other chain will have to do more work, and over time, those links will get worn down. The constant internal torque on the knee with hundreds and thousands of steps a day wears down the medial compartment of the knee. Here are a couple ways that flat foot can be diagnosed. Diagnosis isn't too complicated. All that is needed are some observational tests. Footprinting is done by wetting the soles of the feet and stepping onto a hard surface where a mark is made. A unilateral heel raise tests the strength of the inversion muscles. An insufficient heel raise can signify that there is muscle weakness. Conservative treatment of this deformity is to use orthotics to support the fallen arch or exercise to make the hips and leg muscles stronger to maintain the rigidity of the arch. If those do not work, surgery can be done to fix it. The flexor digitorum transfer can be done to fix the flat foot. In this procedure, the tendon from the FDL muscle is inserted into the hole drilled into the navicular bone. This is done because the tibialis posterior muscle can no longer support the arch, so the new tendon inserted takes over. So in conclusion, we can say that the medial longitudinal arch provides a rigid but also mobile lever for the foot to load onto and push off of. Flat foot can be caused by muscle deficiencies up and down the kinetic chain of the lower extremity. Foot orthotics are the best immediate treatment for people with flat foot, because with a correct eversion angle, the foot will pronate properly and will be able to shock absorb sufficiently, minimizing the stress put on other joints of the lower extremity. And here are my references.